I'm gonna start my video, but before I start my video, I want to make my favorite smoothie. The smoothie that I always order from Tropical Smoothie is a kiwi quencher. And so I have some strawberry yogurt from Trader Joe's. I have some ice with purified water, of course, and then I have some strawberry and kiwis. So I'm about to blend this all up, and then we're gonna sit down and I'm gonna start the video. And while I'm standing up, I could show you guys the baby. I'm currently 20 weeks, 5 days, and he is growing. Yeah, so that was, all right. Let me make my smoothie. What I'm going to be talking about today is uterine fibroids during pregnancy, and I'm going to just dive right into it. And my smoothie did come out amazing. So, uterine fibroids. So here's some statistics really quick. 50 to 80% of women end up developing fibroids. And this is a big percentage of numbers that I just said, 50 to 80%. I fall into that range of that 50 to 80%. And maybe you watching this, you fell into that range of 50 to 80% of getting uterine fibroids. I found out that I had fibroids when I was pregnant with my son, and we were doing the ultrasound at 7 weeks, and they were basically like, you have 2 fibroids. One was 2 centimeters and one was 7 centimeters. Now, what is a fibroid? So we can get into what am I talking about. A fibroid is a mass of tissue, or also known as a tumor. So I was 7 weeks pregnant, and we were doing the ultrasound, and that's when they told me that I did have those tumors in my uterus. They also did tell me at that time, this was back in 2019, that everything's fine. Like, it's super, super, super common that women get fibroids and still have really great pregnancy outcomes and all that stuff. And I do remember at that time I did ask, like, what causes fibroids. I was shocked to know that I basically had some type of basically tumor. Wouldn't you be shocked if someone just all nonchalantly says, yeah, and by the way, you have tumors inside of your body? You'd be like, what? But it was very nonchalant, and the next question I asked was, what causes this? And they told me they don't know. Of course, right? The doctors never know, right? So they're like, we don't know, but we do just know that it's common and that, you know, you can still go on to have a very healthy pregnancy. And I'm very blessed to say that I really did go on to have a healthy baby. He's 4 years old now. Well, they did, actually. They did get in the way, but he still came out very healthy. What I mean by they got in the way was I had so much pain in my pelvis area. It was always pressure. I always had back pain, and it just didn't feel good. I also developed gestational diabetes, and I had to get a C-section. So those were the roadblocks that came with that fibroid, and I'm still not done talking about it. Now we can fast forward to present day, which is 2023. And I'm pregnant with my second. I'm so excited about it. And those fibroids never went away. Like, after I gave birth, they were still there. And I just recently went in to do an anatomy ultrasound. And then this time around, those same fibroids, like that one that was 2 centimeters is pretty much gone. But the one that was 7 centimeters when I was pregnant with my first son is now 8 centimeters. Which is basically the size of a peach. A tumor the size of a peach. Crazy to even think about that. So I recently just left town to go celebrate my son's birthday, also to do a gender reveal with my family. And while I was out of town, I did get a note from my doctor, you know, telling me that they are concerned about the fibroid, but at the same time, what my last doctor said, which was it's common, you know, just basically take it easy, and that I may feel pain or whatever. And so before I got that news, I wasn't taking it easy. And it's not good that I was not taking it easy, because I also was diagnosed with placenta previa. I probably butchered that, but what that is basically when the placenta is covering the cervix, and it's actually very serious. It can lead to death, like bleeding to death, and it could lead to the baby passing away. But with that, they did tell me, because I was doing the anatomy ultrasound a little bit earlier, that it could resolve on its own and my placenta could go up, and then that wouldn't be a big concern like it is right now. So because that's a concern, I'm on pelvic rest until my placenta pretty much moves. And what pelvic rest is basically no exercising, no long walking, no standing too long, and no sex. And no orgasms. Like nothing. Just live your life sex free. So that's what I've been doing until I go into my next ultrasound to see how my placenta is. I also didn't know this with my first pregnancy, but fibroids are such a big deal that it may lead to you getting a C-section, and that's exactly what it led to me getting, along with a whole bunch of other things like that gestational diabetes and my baby being huge and so on and so forth. So after getting a C-section, it was more likely that this placenta situation was going to happen, and having placenta previa basically prevents you from having a natural birth. I wasn't going to go ahead and try to have a natural birth. I was going to go ahead and do a C-section again, only because it was so traumatizing my first time around. It didn't work out, and I was in labor forever. It was just a lot. So I just know this time I'm for sure doing a C-section. Now, getting back to fibroids, when I got that note from my doctor, I started thinking super deeper, like way deeper into it. And so did my husband. Me and him both just really started thinking about it, because I'm sure it was alarming to him when I told him it's a tumor the size of a peach, a small peach. He looked shocked and worried, and he was really on top of me, you know, following doctor's orders right after we had that discussion. And he was saying, you know, there has to be some type of natural remedy that can basically, you know, fix this. And I was like, you're right. And so I just went on with vacation, you know, I just went on with our vacation, and I just followed doctor's orders, and I really, really took it easy. Like, I basically stopped walking altogether. And when you're in Nevada, you walk a lot. Like, even if you don't try to, you just find yourself walking all the time. So I really slowed down. I stopped moving so much and just really followed doctor's orders. So after thinking and sleeping on it, and my baby telling me, Mom, you need vitamin D, I started thinking about, what has vitamin D in it? Like, in my diet, do I even eat vitamin D? And the answer is no. Like, when I'm not pregnant, I don't even really eat breakfast. I drink alcohol when I wasn't pregnant. I was an avid cannabis smoker when I wasn't pregnant, and I would use unhealthy wraps when I was smoking as well. That literally tell you on the packaging it will cause reproductive issues. But did I care about that? No, I just felt like I'm healthy, like that doesn't apply to me, and I'll be fine. So after thinking about that and figuring all this out, and my baby telling me I need vitamin D, and I went to Google, right? And I typed in, does a vitamin D deficiency cause uterine fibroids? That's a very specific search, wouldn't you say so? And a whole bunch of information came back, a whole bunch. And it basically said, yeah. Basically said, if you have a vitamin D deficiency, you are a huge risk at getting uterine fibroids. And I instantly changed my life. I got mushrooms that day. I do not like mushrooms at all whatsoever, not even a little bit. They make me gag. But knowing that I need to increase my vitamin D, I'm just like for it. So I'm putting mushrooms literally in everything. I have some mushrooms literally right here that I'm gonna probably put in salsa or something. But vitamin D is crucial to getting rid of that. And I will say this, before I typed in that specific search, I typed in what causes uterine fibroids, and of course it said what the doctors say. Doctors don't know what causes uterine fibroids, but basically try to have a healthier lifestyle. That's basically something that said like that. So anyways, put that specific search in, whole bunch of information came up basically saying, yes, treasure, you need vitamin D. You are vitamin D deficient. So I also searched how long will it take to make my vitamin D deficiency dissipate. And it basically said 1 to 4 months or 1 to 6 months, which isn't too bad. I basically have that left in my pregnancy. And it said, you know, increasing that vitamin D will decrease your fibroids and decrease the risk of you getting them again. So that's basically what I made this video for, is to tell you if you have uterine fibroids and you think about it and you're like, you know what, I never eat mushrooms. I really don't eat vitamin D like that. Like, I'm really not in the sun 24/7 like that. Like, even the sun's not even enough. You have to ingest vitamin D as well. So I'm just going to show you some things. I have shiitake mushrooms, maitake mushrooms are good, oyster mushrooms are good. And this is specifically for pregnancy. I've never in my life ate a sardine. I might do it on camera to show you guys my reaction of what it is like for me, but eat some sardines because they have vitamin D in them. Oranges have vitamin D in them, but mostly, you know, mushrooms have vitamin D in them. And I say the sun's not enough also because depending on where you live. Like for me, for instance, I live where it's barely sunny half the year. Like, it's really just a blessing for us to have the great weather. So you really got to ingest that vitamin D. Besides that, you know, you also just want to have that healthy lifestyle. Like, make sure you're eating lots of greens, oatmeals, fruits, but really mostly vegetables. And like, if you're like me and you can't work out, it's really crucial that you're eating the right things. Like, you can't be eating a whole bunch of processed foods because you're not able to work out. And those processed foods are gonna hurt you later. And also, you just gotta think of it like this. If you're like myself, you're getting ready for birth. You're getting ready for surgery. Like, I'm getting a C-section. So you wanna be as healthy as you possibly can so you make it through and can be there for your child in the end. You know what I'm saying? Like, we wanna live after the birth. I'm going to continue with the new things I'm adding into my diet, which is lots of mushrooms, lots of fatty fishes, you know, lots of more oranges, everything with vitamin D pretty much. I'm about to extremely consume every single day. Now, I'm not going to overly do it. I'm going to do the recommended amount, of course, because too much vitamin D can lead to kidney stones and like other horrible things you don't want. So make sure you're keeping it in that recommended amount for a pregnant person. And do it. And well, I know that I have a doctor's appointment coming up in June, so they are going to be looking at that fibroid again, and I'll let you guys know if it shrank, because that's what my goal is, to make it go away, so that it doesn't mess with the baby's growth or any type of things like that. And if you're like me, it's easy to stress out, especially when it comes to your health and hearing that you're not as healthy as you thought you were, or just like shocking news like you have fibroids, you know. But the best thing I can say is, instead of stressing out, feel more positive about how you're going to transition and make it go away. Don't let it stress you out. Just continue to be healthy and happy for your baby, and I wish you all the best moms to be. And until next time, I'll see you soon. I do have another video that I'm going to actually start editing now for the gender reveal and all those things. That's all that I have to talk about today. And until next time, I wish you all the best.